Good evening, everyone. My name is Ahmad Sheikh. Hope all is well. We welcome you tonight, and I wanted to quickly tell everyone the purpose of our program this evening and to introduce our esteemed guests. Vaccine hesitancy, how to build trust in the minority communities, fact versus fiction, dispelling all the myths of the COVID vaccine. And we are here with an esteemed subject matter experts. First, we'll be joined by Dr. Debbie Salas Lopez. She is the Senior Vice President, Community and Population Health at Northwell Health. Ms. Barbara Felker, Vice President, Strategic Community Partnerships, Community and Population Health at Northwell Health. Dr. Sanjay Gupta, Chairperson of Emergency Medicine, South Shore University Hospital, Associate Professor of Emergency Medicine, Zucker School of Medicine at Hofstra Northwell. Dr. Isabella Park, Associate Medical Director at Long Island Jewish Forest Hills, the Director of Palliative Care, Long Island Jewish Forest Hills, Assistant Professor at Zucker School of Medicine at Hofstra Northwell. We are also joined by Dr. Zubair Hassan, who is the Assistant Professor, Division of Pulmonary Critical Care and Sleep Medicine, Zucker School of Medicine at Hofstra Northwell. The Honorable County Executive, Laura Curran, the Executive Director of the Office of Asian American Affairs, Ms. Farah Mozawala, and Dr. Isma Chaudhry, Director and Executive in Residence, Graduate Public Health Programs, Hofstra University, the first female president and chair of the Islamic Center of Long Island, and the chair of the Asian American Council of Nassau County. I wanted to welcome everyone this evening, and thank you very much for joining us.
Thank you, Ahmad. Thank you so much for that introduction, and welcome everyone. I would like to introduce Ahmad Sheikh, our producer of this event. So Ahmad is a marketing consultant and media specialist, president of High Traffic Marketing. He has been instrumental in driving traffic and keeping small businesses in the Asian communities afloat during the hard times that we were suffering and our businesses were suffering due to the pandemic. He also stepped up during the pandemic, launching a web series called Coping with COVID, where he tackled issues like mental health and wellness, domestic violence, food insecurities, and served as a source to get the information out from the county and the state to the various communities of Long Island. He also created events for children and during the pandemic, including various discussions, a virtual concert, that's amazing, and even talk with an NBA basketball player. So, and last but not least, Ahmad serves as the Secretary of Asian American Advisory Council. Thank you, Ahmad, for putting this together. And so I would really like to thank all our esteemed panelists for taking up this time to address such an important concern that the communities have regarding COVID vaccine. There has been a lot of misinformation, myths that needs to be dispelled in the communities. We need to get the right information from the right sources. So we're going to delve into the questions right away and start our discussion session. We have received many concerns and questions, even the one where there has been news or social media news about microchips in the vaccine. So these are concerns. I would be respectful to all the concerns. And if there is one thing that this pandemic has taught us, it is the importance of our codependency on each other and the environment. We are in it together. For each one of us has a very, very important role to play if we want to get back to the life that we once knew. So we have that responsibility to get the right information to get those questions answered, and then to make those right decisions for not just ourselves and our families, but for our communities and for our nation. So, my first question addresses the skepticism and distrust towards science and technology that we cannot ignore. And there is a history and politics behind this lack of trust. I'm going to ask Ms. Felker and County Executive, how are we planning to build trust in the minority communities, and how do we address vaccine hesitancy in these communities? County Executive, you can go first, and then Ms. Felker, Reverend Felker, please.
Absolutely. So, first of all, Ahmad, thank you so much for convening this. I'm really happy that we're communicating with our Asian communities, our growing Asian communities here in Nassau County about the vaccine. I will publicly take the vaccine. I am confident that the vaccine is safe, that it's effective, and I really see it as a way for us to get back to some kind of normal. We can get our businesses cranking again. We can keep our children in school, which is so incredibly important. People will, we can lessen the anxiety that this pandemic has caused. And I think the vaccine is a real way to do that. I'm so happy to see so many people who are on this panel at Northwell. You look around and you see experts in so many different medical fields. We also know that Northwell will be distributing the vaccine in our Long Island region. I've been speaking with the folks at Northwell. We have a very, we're going to be rolling out a really good, comprehensive plan to make sure there is equitable and safe distribution and administration of this vaccine, working with the partners at Northwell. So I feel confident that we are in good hands. So I want to say that. Now, I do understand that among our communities of color, there's skepticism among all communities, but we do see a little more of that in our communities of color, and understanding the history of stuff that's gone on in our country. I fully understand that. So it's really up to us to instill the confidence, to let people know that this is okay, that they can feel good about getting this vaccine. So I feel that our job at the county is really getting across information. I think people look to us, especially during COVID, they look to local government for information, for numbers, for data, for what are the experts saying, what are the regulations, what are the protocols, and we've sort of gotten into that, pretty heavy throughout this pandemic. So I want to continue that role as it relates to the vaccine. Clearly, I don't have a DR in front of my name. I don't know if people will take my medical advice, but I certainly want to make sure that I can be a good filter for the information and to get it out to all of our communities. Now, that will involve all communities of color, key stakeholders in all communities, including communities of color, coming up and taking a leadership role, helping us, being those trusted messengers in our diverse communities here on Long Island and here in Nassau County. So we are fully committed to doing this. We have a wonderful director of health equity in our health department, hired last year, Dr. Andrea Alt-Brutus, who is already working on this. There was a big piece in Newsday where she was featured about how we're going to do this, how we're going to communicate. Faith leaders, education leaders, labor leaders, whatever it is, we will interact with them. And I think we can do a good job. We did it with the census. We had actually the #1 response rate for census because we engaged community stakeholders, trusted messengers. I want to do the same thing with the vaccine.
Thank you, County Executive. Reverend Felker.
Yes. Good evening. Thank you for having me as part of this esteemed panel. Unfortunately, there are strong feelings of mistrust in the communities of color that are heavily influenced on historical experiences such as the Tuskegee experiment and unknown sterilizations and hysterectomies that have occurred in the past, procedures that people were not consenting or even knowledgeable that had occurred. In addition to that, we have a cloud of political influence that has existed over the vaccine since the early development process under the current administration. A lot of people are nervous at the fact that it happened so quickly, where in normal circumstances, it would take 10 years to deliver a new vaccine. And here we were able to do it in 10 months. In looking at the Pew Research Center, they conducted an online survey of approximately 13,000 US adults with a random sampling of residential addresses. The study was detailed in the December 3rd Science and Society segment of the New York Times and demonstrated an increase in the public's confidence in the research and development of the process. Now, in this last study, which was conducted very late November, early December, 60% of the participants said they would get the vaccine and 39% said they would not, which was a great improvement as to what existed to prior surveys. What is very important is that one of the key strategies we use at Northwell is to really reach out to the trusted entity of the community, which are the faith leaders, and have them communicate to the community because the community responds and trusts the positions that they exhibit and that they share. We recently, last week, had a faith leaders forum with various faith leaders from a very diverse population. Dr. Ishma Chaudhry was part of it. I was very grateful for that. And we had questions from the community, from the faith leaders, and we were able to answer what we could, but what we really wanted to hear were the questions from them. One of our strategies is to educate. And the faith leaders had requested that we educate them so that when they speak in the community, they can speak with facts and with educated information. So we have had these forums. We will continue to have more forums. We've developed strong community partnerships with our faith leaders. We did COVID testing at the churches. A lot of the faith leaders came out saying they would take the test first as a leading by example to their congregants and the communities that they serve. So we will continue to do that. After our forum, we've developed the FAQ, frequently asked questions. We've developed an executive statement, an executive summary of the facts that we have. We will be producing webinars. This is for the faith leaders, community leaders, and for the community at large. The more we put education available and accessible to the community, the less fear they can have. This is not something that you can just say, I'm going to do it, follow my lead. This is something that you have to really demonstrate the information, the facts, the things that we may not know well. One of the questions that came out of the forum, which was something we had not thought about, were there animal products in the vaccine? And that was something that we went right back and started to look at the World Health Organization and CDC to find out contents of the vaccine. So it will be an ongoing education, a process that we will continue to provide education and information to the leadership, to the faith leaders, and to all that. The more education we put out, the more informed people will be and the more comfortable they will feel about making their decision.
Thank you so much, Reverend Felker, and that was really, it made me, I'm following you. So it made me really, and so many other communities which are listening over here. Thank you so much for that. I'm gonna ask Ms. Mozawala, you are connected with, through your office, through a lot of minority communities in the county. What do you hear? What are certain steps that you plan to take to build that trust in the Asian, South Asian, and other minority communities?
Thank you, Dr. Isma Chaudhry. As County Executive Laura Curran said, that we are trying to launch a campaign of public awareness and developing confidence for the vaccine. Our office gets about 100 to 150 calls weekly. And now I'm starting to see some of the calls coming in about the vaccine. For instance, people are worried about their immigration status. Will that be checked? People are worried, about the safety of the vaccine. Will it affect fertility? So those are the type of questions we are getting in the office now. When you're dealing with minority communities and immigrant communities, you have to be culturally sensitive. You need to have language access. So in our office, we have not just, a language line. We have actual people who speak Urdu, Hindi, Mandarin, Arabic, and Bangla. So we're able to converse with them. We know the nuances, the cultural sensitivities within these communities. Look, in order to get herd immunity, you need to have 85% of the population or 75% of the population, take the vaccine. So if 30% of your population are communities of color and immigrant communities, you need to have them on board. And that's extremely important. And we're hoping that through our outreach offices in the county, we're able to, develop that level of confidence.
Thank you so much, Farah. I'm going to just get into some of the safety issues about the vaccine that the communities are concerned. And after we started advertising this panel, we heard a lot of these questions. So I'm going to ask Dr. Hassan and Dr. Park to address some of the complications that people think they're going to have or have been reported or not reported, specifically genetic disorders with the vaccine, male fertility, and Bell's palsy. So Dr. Hassan, then Dr. Park, if you can just discuss genetic disorders and male fertility.
Assalamu alaikum, everybody. Thank you, Dr. Chaudhary and Ahmad and everyone for inviting me. So by and large, the biggest potential side effect people will experience with the vaccine is just some soreness in the arm after the vaccine is given. Some patients do just develop fevers or sore throats after the vaccine is given for a day or so. It goes away. And that's normal. That's the body's reaction to getting the vaccine and making antibodies against it. It's actually a good sign. It means that the vaccine is working and doing what we want it to do to help protect against the virus. In the studies that have been done on the vaccine, there are very, very, very rare side effects that patients have experienced. And honestly, based on the numbers, it's no more than a random population of people who didn't receive the vaccine would get also. One of them is Bell's palsy. In the study of 20,000 people that got the vaccine, I think about 4 patients developed this. And Bell's palsy is just it's a very brief period where patients develop numbness or weakness of one of the facial muscles. And then again, it's self-limited and goes away on its own. Fairly benign in the grand scheme of illnesses that you can get. But it is a very rare side effect. And again, it's not any more than what would be expected in a random population of people in the general community. So in terms of safety and risk benefits for getting the vaccine, the benefits of the vaccine far, far outweigh any risk. And I myself got the vaccine knowing these potential side effects, and I don't think that it's worth not getting the vaccine. I think the benefit of taking it is far greater. There was also a question about a potential risk to male fertility. So there have been some studies in patients that got COVID itself, got the infection of COVID, and they found that some of these patients had evidence of the virus in their sperm, and it affected their ability to have children. Now, that's again in patients that actually had COVID. There's been nothing like that reported, as far as I'm aware, in patients that got the vaccine. But it also just furthers the point that if getting the virus itself can cause these problems, maybe getting the vaccine and protecting against the virus will help prevent some of these problems. There's still so much we don't know about the virus itself, and we're still learning that protecting against the virus is probably the best thing we can do to protect against any of these other potential problems that people are having because of the virus.
Thank you, Dr. Hassan. Dr. Park.
So I agree with Dr. Hassan about, the benefits and versus the risks. And just like Dr. Hassan said, I myself, took the vaccine last week, and the side effects that you're going to feel are expected usually within 24 hours and may last for another 2 to 3 days. And I did have muscle weakness, achiness, low-grade fever, and even a headache. And that pretty much resolved by day 3 for me. And it's good that we're very, very honest and transparent about the side effects so that it doesn't freak people out. And it is oftentimes what you see after even other other vaccines, such as most commonly the flu shot. So you are going to feel that achiness and feel like flu-like symptoms. So these are some of the symptoms I had when I had COVID. I had COVID back in April. And so it's good that we're very transparent with the side effects, expected side effects. The other side effects that we are very, very rare are going to be the anaphylactic type of, symptoms that, that reactions that may have. But usually you have to be very careful and know your history really well. There is a survey that you do fill out before you take the vaccines. And you do have to consult your doctor if you do have evidence or history of any type of allergies, or especially anaphylaxis, and especially previously from vaccines before. So you should have to have that conversation with your physicians. And we do monitor patients after 15 minutes, for 15 minutes after the vaccine. And if you did have history of allergies or anaphylaxis, you do monitor them for even longer. And those that did have those type of severe, reactions, they do get those symptoms, pretty within that window of that 30 minutes. The idea of Bell's palsy is very much just like Dr. Hassan said, it's a very rare, and the incidence is the same as in the general population, not like the in the vaccine trials as well. And just like Dr. Hassan said, with the male fertility, I think that was from the idea of when the COVID vaccine, when people had studied those who had the vaccine, but I think it's also from, because I was trying to research where could this have had, that concern have come from. And I think it's when people, especially in the Muslim community, when people are concerned about the ingredients and if they're halal or not, if they have any products or the concerns. And there were some misinformation that happened, in the past month or two, that it's going to change the DNA or affect it and cause infertility issues. But there's no evidence, and it's been already been confirmed that any of the ingredients, especially in Pfizer's and Moderna's ingredients, none of them are non-halal. So you do not have to concern about that. I think that's where the concern for male infertility came from. Perhaps. And there are also some type of misinformation, or maybe some information that the spike protein, where the mRNA, where this Pfizer vaccine is from, there were some concerns that it was very similar to some cells or from the placenta, which may cause some issues with fertility or miscarriages. And that also is extremely, extremely such a very rare incidence that it's not even true or been proven to cause any type of infertility. I don't know anything about genetic disorders. I've been trying to research it online. I haven't found anything where it can cause genetic issues or disorders, but I think it also stemmed from the fact that because the vaccine is from a genetic, it's a genetic vaccine, not from a live vaccine. Maybe there were some concerns about that. And again, this is a very small, tiny little mRNA protein, and it doesn't enter the cell nucleus where it affects the DNA. It's sent into the cell to replicate and to generate an antigen, so that way it can instigate an immune response. So again, I think it all stems from that information, because it's a new genetic type of vaccine. That's where the concerns are from.
Great, thank you, Dr. Park. Ahmad, you can come here. You have a few questions.
So first and foremost, I want to thank the audience. We have a considerable audience watching, and the questions are coming in rapid fire. I assure you, we will do our level best to answer as many of the questions as they come in. We do have some specific questions that we want to touch upon, and they will touch upon and answer the questions that you're already asking. So one of the questions that has been coming in is, and I'm going to ask Dr. Gupta and Dr. Hassan. So Dr. Gupta first, why is it important to get the vaccine to begin with? people have talked about, all of these people have gotten it, and eventually we will reach herd immunity, and all of these terms. But why is it important to actually get the vaccine?
Yeah, I'm happy to go. I think that's a good question that has a lot of layers. I think, one way to look at this right now is on a public health standpoint. So when you look at the number of confirmed infections that we have right now across the country, which has been over 18 million, and the number of deaths that we've had. So there's something called the case fatality rate. So our case fatality rate still with this virus is approaching 2%. So if you think about that, which is really horrible to think that 2 out of 100 people that might get infected might still pass from this. Maybe not in our region, but this virus is really, at this point, kind of spread all over our country and really affecting wide swaths of our population. And even beyond that, deaths aside, because people cite, this low death rate, we're starting to learn more and more that this virus might cause long-standing health concerns. And people, maybe even up to 10% of people who receive the virus, we've gotten reports and, research and, just even our own observations and experience that, this causes inflammation of the heart, for one example. This might cause inflammatory diseases to occur in people. So the idea of getting the vaccine, one is, to protect yourself from infection, because we really don't know. We can't really predict on a person-by-person basis what the infection might actually cause in you. I mean, we have people on this panel who've had COVID. We've had people who have not had COVID. But it's really unpredictable about what health problems it will cause if you do get it. Number two, as we talk about herd immunity and protecting our communities, think about protecting our communities. We all have siblings, we all have friends, we all have parents who might be older, who might have comorbidities, and there are people out there who have health conditions that could really be affected by this virus. So by us being immunized, we help protect all the people that are really important around us. So these are the people in our communities, in our churches, in our temples, in our faith communities, in our healthcare communities. You protect your neighbors by receiving the vaccine. So I think that's important. It's important for not only your own personal health, but it's important for the health of the people surrounding you and kind of your greater community surrounding you. Sorry, that's my long answer to a short question.
Thank you very much. And I wanted to continue with that with Dr. Hassan. Again, why is it important to get the vaccine?
Yeah, I mean, to echo what Dr. Gupta said, obviously there's the personal health benefit. I mean, there's a fairly significant number of people who passed away because of the virus. I mean, I think that's pretty obvious. Even though the percentage seems small, there's a large number of people who have the virus. So the number of patients that have died obviously is very big. But what's more concerning, I think, for other people that have gotten the virus and who are lucky enough to have lived, is the long-term effects of COVID. And that's what we're still seeing in the hospital today. I work in the ICU. I see these patients a lot where, they're coming in for something not related to COVID at all, seemingly, but we ask, did they have COVID? Is this related to that? There's patients that are young, really healthy, who come back with heart problems, like Dr. Gupta was saying. So the famous college basketball player who had a sudden cardiac arrest on the court where his heart stopped, and they believed that it was related to a COVID infection he had a couple months ago. There's patients who come in with neurological problems, brain problems or strokes or clots in their lung. That to me is a lot more terrifying than being sick in the hospital, because it really does change the way you behave, the way you live your life long term. We don't know what disability you can have because you have gotten the virus. So it's important to get the vaccine so you protect yourself and don't have that problem in the first place. And plenty of young patients who have gotten COVID who, thought they were invincible beforehand, and then get it and say, I've never been that winded before in my life, and it's been weeks since I had COVID, or I've never had this problem before, I've never been hospitalized before. And I've heard that a lot in the last few months. since this began, where patients say, I've never been hospitalized before, I've never had to see a doctor before because of this virus, and it's because I thought I could hang out with friends or whatever however they got it. The vaccine will help protect against that. And more importantly, I think that's something that everyone wants to do, is the vaccine is going to help us get back to normal. So everyone wants to act like we didn't have this pandemic, which is obviously everyone's goal. Before, I guess, December of 2019 was really the last time we were normal, about a year ago, just about. The best way to do that is not to pretend that the virus doesn't exist. It's to socially distance, wear masks, but also get the vaccine when it's available to you. Protecting yourself against even getting the virus is the first step and the biggest step towards normalcy. If enough people get the vaccine in the coming months, then hopefully, God willing, this time next year, we'll be able to be celebrating time off, vacation, whatever, friends, family, the way we have been for years before this. And that's one of the reasons everyone I know has been getting the vaccine. It's a one big step towards normalcy, let alone one big step towards protecting yourself against something that's potentially catastrophic.
Great. Thank you so much, Dr. Hassan. So the good thing is that we are actually getting so many questions. I think, so I just want everybody to know we are not ignoring you, but I wouldn't be able to respond to my texts. So, but we will try to get to all the questions, or at least try to arrange so that your questions are taken care of. So I'm going to just go into a little bit of what is messenger RNA technology. And I'm going to ask Dr. Gupta and Dr. Park to talk to us about how old is messenger RNA technology. It's I know it's not a new technology, but a lot of people think that last week we figured out there is a messenger RNA and we said, okay, we're going to use that. So it's important to address that, if you could kindly, and then can these messenger RNA vaccines affect the DNA? Thus the concern about genetic disorders. And then I have another question, and Ahmad, I'm going to request you. There's a lot of questions coming in on animal byproducts and fetal cells. So that's a concern of the community. And are these vaccines halal? Is there what would a Muslim jurist say to that? So while we are having Dr. Gupta and Dr. Hassan talk about the mRNA technology, if you can try to get Mufti Farhan, if he can respond to those questions. Thank you so much. Dr. Gupta.
So Dr. Gupta may have become frozen. And Sister Isma, I believe you're on mute.
So I got it. So thank you. This is all I'm hearing. I never use the word mute so much for myself. So Dr. Hassan, before I think Dr. Gupta is joining in. So if you can please take this question, and then Dr. Gupta can take it from there, and we can keep the flow going. So thank you.
Sure, and I think Dr. Park may have some more information on this as well. But mRNA technology is not new. Like you said, we didn't come up with it in the last couple months. It's been studied before. It's just my understanding is we've never actually had to deploy a new vaccine like this before, because we've never had an illness like this before. And again, to echo what Dr. Park had said earlier, this technology is safe. It's not going to alter your DNA at all. That's not the way mRNA, messenger RNA, works. If you think back to your biology class from high school, the messenger RNA is just instructions on how to make a protein, and then it sort of disappears. The body does a good job of reading that instruction, making the protein, and then making the antibodies against that protein. The vaccine itself doesn't give you the virus. It's not instructions on how to make the virus. The body doesn't learn how to make the virus because of the mRNA. It doesn't incorporate into your own genetic material. It's not designed for that at all. And this is something that we've known for a very, very long time on how mRNA works. So in that sense, it's very safe. And I think Dr. Park may be able to speak a little bit more about the history of mRNA vaccines and that technology.
Thanks, Dr. Hassan. Just, like you were saying, that there are DNA-based vaccines. There were thoughts of it, but the mRNA has been much faster and easier to develop. Usually vaccines are made usually from parts of viruses. There's the attenuated virus, and there's also the
The beauty of live.
She's our CNO, who's just having the end of it. Thank you. And you have to remember, back when vaccines were used to be made, it took many years because using attenuated, meaning live vaccines, and also weakened vaccines and dead vaccines. And that took so much longer, which was why, because of this pandemic, when millions of lives are being affected, so many hundreds of thousands are dying, we needed to be moved very, very fast. So when we first understood the genetic sequence, and they were able to genetically engineer the mRNA proteins, and that's where we hit the spot and said, we can do this. We can now generate something and elicit an immune response and develop it very quickly. So this was never done before. Never had we had this much attention and speed and money and volunteers to be part of this trial, which is why it's so much faster, and it threw everybody by storm. And we were all shocked at how fast we can do it, but we needed it. In order to do this very quickly, we needed to use science and technology, and that's the first time ever we were able to do so. And mRNA technology is not new. Just like we had said before, it's being used for rabies, and I have it written down: rabies, HIV, Zika. There are a lot of uses for it, but never before like this, which is why it's very surprising and shocking, but we are so lucky we can do this.
Thank you, Dr. Park. Dr. Gupta, are there any animal byproducts or fetal byproducts in this mRNA vaccine?
All right, can you hear me, or am I still muted?
Yes, we can.
All right, perfect. So that's an excellent question. So in these vaccines, the Moderna vaccine and in the Pfizer vaccine, no, there were in fact no animal byproducts used in either vaccine, because just as Dr. Park had mentioned, these are both based on synthetic messenger RNA. So no animal lines, no human fetal cells. None of these have been used in the production of these two vaccines.
So much. And we have Mufti Muhammad Farhan. We are extremely fortunate to have you, Dr. Farhan, and he's the executive director of Islamic Center of Long Island and wears many hats, and as Ahmad calls him, the Mufti of Long Island. So Mufti Saab, there is a question: is this vaccine, the Pfizer and the Moderna vaccine? I'm going to talk about the mRNA vaccines at this time. So are they halal?
Assalamu alaikum. Good evening, everyone. And I'm honored, and thank you to all our health care workers and for what you have done for us for the past year. There's no words that we can thank you for doing what you have done. And just quickly jumping into, I know it's because of lack of time, but I'm just going to quickly jump into one important factor before I say this, because this has been going through the entire community for many days now, that there are certain particular maxims of faith that we must remember that are the universal maxims that govern us. And one of them is the prevention of life is the highest objective of the law of the faith. And trivial things are excused, and we have been forbidden from being overly technical as believers. And the Almighty wants ease for his servants and never wants hardship. These are certain maxims to always remember in our faith before we discuss that. And now when we go to the technical portion of it, the main ingredients, as we mentioned already, and of course all the esteemed physicians have mentioned and doctors have mentioned, is that the vaccine, of course, is the nucleoside modified messenger that does not and is not sourced from any animal source. So Islamically, boards and jurists from across the globe, starting all the way from Australia to Malaysia to the Asian area towards Europe, and of course now in America, multiple boards of scholars have sat down and they have given permissibility, and even recommended and asked for people to go ahead and take this, because preservation and protecting of life is one of the essential components of our faith.
Mufti Saab, thank you so much for that comprehensive answer and addressing this question. Thank you so much. I'm going to move forward and ask Reverend Felker and Ms. Mozawala. So how do you address the distribution equity and the distribution logistics of this vaccine? When is Long Island, Nassau County, Suffolk County, when is the vaccine? When should we expect the vaccine for the general population? And what would be the points of distribution? Do people have to go to primary cares or to pharmacies? So if you can throw some light on it, and especially the aspect of distribution equity, how will you achieve that? Thank you, Reverend Felker.
Yes. Actually, I would like to defer that question to Dr. Debbie Salas Lopez, because she was in a meeting today where they addressed, and this information is being developed as we speak and must be updated. So she has the latest and the greatest on that. So
how
Dr.
lucky
Salas
are
Lopez?
we to get this information firsthand? Thank you, Dr. Lopez.
Thank you, Dr. Chowdhury, for inviting me, and thank you, Reverend Felker. So today, in fact, we had a meeting with the county executives, and County Executive Laura Curran was on that meeting, where we shared what has been given to us by Governor Cuomo as a charge, Northwell Health being the regional hub of the distribution of the vaccine. We, in turn, have created 2 sub-regions, Nassau County and Suffolk County, because both vaccines require refrigeration, freezer refrigeration, and there's quite a logistical process that we have to go through. Each county will create 3 separate offices, one of which will be operations, the second will be logistics, and the third will be planning. The regional hubs that are being created are for phase 1A and B. And as you know, these are essential workers, healthcare workers, and so on. The timing between phases remains to be seen. We have to vaccinate a little over 1 million people in Nassau County and a little over 1.2 million people in Suffolk County, not once, but twice. And so today, in this phase that we're in, the hospitals serve as regional hubs for distribution of the vaccine and or areas that can accommodate what we need to be able to distribute the vaccine safely, which include big freezers. We also have to make sure that we're documenting logistically which community member got which vaccine and at what location, because the second vaccine has to be the same vaccine. So for now, yes, in the future, we anticipate that we will be developing other locations, schools, libraries, faith-based locations, community centers, and so on. For now, in this phase, we're keeping it within a hospital and close to hospital regional distribution. But we anticipate when the general population, which is phase 2, gets it, that we will be distributing it more widely and in different settings, such as libraries and schools and so on. Again, this information changes because it depends on the volume of vaccines that we get and the number of people coming in to get vaccinated. That's how quickly we'll know how to move from one phase into the other.
Great. Thank you so much, Dr. Lopez. Ms. Mozawala, do you have any information that you can add from the county?
So again, I just echo Dr. Lopez's statements. It's really, it is Northwell Health that is the regional hub for Long Island. So really they're taking the lead. And since the situation is so fluid, we're just waiting for their lead and we're going to follow suit. There are 10 different regions within New York State, but for the Long Island area, it's Northwell Health.
Great, thank you so much. So I'm going to move on to another question. We have seen that whenever there is, a public response, there is a lot of scams around that as well. So I want, if Dr. Lopez, you and then Ms. Mazzawala, if you guys can address, how do you plan to address fraud alerts or reporting frauds or scams, pharmacies online, or get your medicine from Canada? Say what we have all heard it all. So what is the plan for that? How do you plan for COVID vaccine scams?
Okay. So today, the way the vaccine is highly, the way it's managed and it's handled, the way it comes in, because the vaccine has to be kept at certain temperatures. It's very high. It's highly secured. The vaccines that come in. Now, whenever there is a case of there's less supply than there is demand, there's always the risk that there's going to be fraud and online scam. And so the New York State Department will be alerted by community members and or anyone that suspects fraud. We, as a regional hub, will also be able to accept those warnings and those calls so that we can give it to the state to investigate. And I anticipate that the county offices will as well. They'll give it to us and we in turn will give it to the state of New York.
So for the county side, what we do is you would just, again, let the state know, which is if you go onto the ny.gov, /vaccine, there's actually a form that you can fill out for any sort of, it's an enforcement task force for violations, and it's like a complaint form. So you could fill that out for any sort of complaint that you have and they'll address it. There's also a state hotline that you can call. That number is 1-888-364-3065. And I'm also going to give you our COVID hotline for the county, which is 227-9570. So those are the numbers. I don't know if Ahmad, you can put them in the chat or I can give them to you later on. But those numbers would be the ones that you would call if there was any sort of fraud.
Thank you. Thank you, Farah. Ahmad, you had a few questions come in?
Yeah, so I mean, questions are coming in rapid fire. So what I'm going to ask is if we could answer these questions in a quicker way. Just the last thing I would want is all of these questions that have come in that we don't get to them. So the question I have, and I'm going to ask this for Dr. Lopez, is how much does the vaccine cost? It's how much is it going to cost me? How much is it going to cost you? And what will be our out-of-pocket expense?
Governor Cuomo has made a commitment that the vaccine will be free to the members of New York State.
So that regardless, insurance, no insurance, it's free.
It's free.
Wow.
Ahmad, you got your quick answer.
No argument there. And,
no argument there.
This is what the pandemic has done in this country and in our state. And remember, we were ground zero, New York State. It has ravaged our communities, particularly our communities of color. And we want to, make sure that everyone receives the vaccine. Everyone that wants the vaccine gets it, irrespective of their ability to pay.
Great.
That's incredible.
That's great. So I'm gonna Ahmad, I'm gonna take your lead, and we're gonna just do a rapid fire question answer session. So Dr. Gupta, how long after receiving the vaccine is an individual immune?
Oh, that's a great question. So as was mentioned before, these vaccines are 2-dose vaccines. So it's going to take a number of weeks. So the first dose is usually a primer dose. The second dose is a few weeks later. So with the Pfizer vaccine, you'll receive your second dose 3 weeks later. With the Moderna vaccine, it'll be 4 weeks later. and you would suspect that you would have, you know, kind of optimized immunity after the vaccine several weeks afterwards, as your immune system is, you know, responding to the vaccination. So within a few weeks of being vaccinated, you should be immunized.
Great. Thank you. Ahmad, you have a question coming in?
So the question that I have is, when someone gets the vaccine, do they need, like, okay, if someone gets a vaccine, how cautious do they need to be? Do they need to wear a mask? Can, you know, does life go back to normal? Do they, you know, I mean, everyone's striving for normalcy. Will the vaccine give that to them? And Dr. Park, if you would be so kind.
Sure, that's a really good question, because we're thinking that the vaccine is going to solve all our problems and life is going to go back to normal. But just understand, just because we have the vaccine, the point of the vaccine is to give us a very strong immune response. So when we do get exposed, we can we have the immune response enough to fight it, so we don't have a very serious COVID infection. It doesn't mean that we still can't get the COVID infection. It doesn't mean that we can't have it, and it may not affect us as strongly, but it doesn't also mean that we can't give it to somebody else. So once we even get it, even after the second shot and we're feeling fully immunized, we should still be wearing masks in public or in closed settings. We should try to socially distance, still practice safe, you know, hand hygiene, and be aware of anybody else who might be high risk. So even if we do have it, we shouldn't let our guards down, because we can potentially even pass the infection from one person to another. And that's something that we encountered in asymptomatic carriers too. And we may unknowingly infect our elderly loved ones.
Thank you, Dr. Park. So a quick question, Dr. Gupta. What is the difference between the two vaccines? We now have rolled out Moderna and Pfizer. Is there a preference, one over the other? And that's a question coming in as well. But if you can just respond to that.
Sure. Yeah, certainly. So there are two vaccines now. The Moderna vaccine and the Pfizer vaccine are both mRNA vaccines. They use similar technologies, but developed separately. You know, in fact, Moderna actually is short for modified RNA. This company actually started 10 years ago on the basis of utilizing this technology. So the whole basis of their biotech company is on utilizing modified RNA for medical care. So some key differences have been mentioned. Pfizer's vaccine, because they are created differently, although using the same technology, you know, they have different chemical structures and stability. So the Pfizer vaccine has to be stored in deep freeze, you know, negative 70 degrees centigrade, whereas Moderna vaccine can be stored at a negative 20 degrees centigrade, which is more like a freezer type temperature. So, I mean, that's the big difference with administration. Again, the Pfizer vaccine is a first dose, and your second dose is 3 weeks later. Moderna vaccine is your initial dose, and then your second dose is 4 weeks later. And, you know, all things considering, with the trials, the efficacy of the Pfizer vaccine was 95%. The efficacy of the Moderna vaccine was 94%. So when you look at those sort of outcomes, I would say that the preference should be based on whatever is in front of you. Take it, because it's going to work very similarly with both.
Great. Thanks, Dr. Gupta. I have another question. Do individuals who have already acquired COVID infection, do they need to vaccinate themselves? And if Dr. Hassan, if you can take that question, please.
Sure. So the question is, do patients that have gotten COVID itself, do they need to get the vaccine? And the answer is yes. There's still, you know, natural immunity, which is what you get when your own body gets the virus and it's been exposed to it. It's not as good as the immunity that you can get with the vaccine. You know, the guidelines suggest that the immunity that your body gets because of the vaccine is a lot more stronger than anything you can have by getting the vaccine, getting the virus itself. In fact, patients that have had the COVID in the past who had their antibodies drawn, many months ago, are finding now if they get their antibodies drawn, meaning a blood test, they don't have the immunity that they used to have, meaning they're no longer immune. And studies show that vaccine immunity lasts a lot longer than having had the infection itself. So the general recommendation is that even if you've had COVID, even if you have antibodies to COVID because you had COVID in the past, you should still get the vaccine because it'll be far better and likely much more longer lasting immunity.
So, Dr. Zubair, as you answer this question, there's another question that came in, which is like a part B. And so to piggyback, we have a question coming from Evelyn, and she mentioned how often will we need to get vaccinated, and how long, what is the amount of time that the antibodies stay in the body?
Right. So so multiple parts to her question. If you've already had COVID-19, I think she's asking how long did those antibodies stay in the body? And the answer is we don't know how long antibodies stay in your body if you've had COVID already. We do know that some patients it does wane, meaning it decreases over time. As far as how long will the vaccine be effective for, meaning do we have to get it every year like we do the flu vaccine? That's yet to be determined. It's not very clear as yet if you will have to get the vaccine every X number of years. How long does that immunity last? Unfortunately, we don't know the answer to that. That's the short answer of it. But in general, with vaccines, we do know, again, that antibodies that are produced because of vaccines tend to last a long time, a lot longer than if you had the infection itself. So again, that's probably the most important take-home point.
Thank you very much. Thank you very much, Dr. Hassan. So I have another question that it has come in, and this one has to do around the Asian population. So there's been a lot of news around specific testing around specific ethnic groups. So when it comes to the Asian population, and I'm going to ask you, Dr. Park, has there been enough testing, especially in phase 3, on the Asian population?
No, put it simply, not enough. And I think, when I was trying to research some of the information, this question, I was seeing a lot of, articles and, there have been some efforts, and I think you've seen that we're trying to do more outreach into the communities of color, especially the Black and Hispanic communities. But it's increasing, but it's still not enough, because think about all the communities that have been affected and been hit really hard from COVID, and that has been in the communities of color. So to accurately reflect that into the clinical trials, it's a huge undertaking, and there's so many different factors and challenges and barriers to ensure that there is fair representation. And that's with, just like Reverend Faulkner had said before too, because of the mistrust and the disparities from years ago, it's hard to try to gain that trust again and be part of a clinical trial. So there's that. And also, the investigators who've been involved in any type of trials, most of them are not of color, and there is very little diversity in research leadership too. So, which is why we really need to, invest and have leadership in administration, and also the local governing leadership as well, to really advocate for better trials and be inclusive. So it really opened up a lot of conversation, especially during this pandemic. So I'm glad that there is conversation and that there's focus on it. But yes, we could definitely do more. It is represented, and it seems like, as we are as we continue the trials all over the world, we will have see better representation.
Thank you very much. I mean, that's a candid reality that we live in. I just have 2 questions that have just come in from Vanna Yi on behalf of the Chinese community. And so the first question, and this is for Dr. Lopez, when will Nassau County's phase 2 vaccination administration plan be out? And will schools be part of that plan?
The honest answer is we don't know. The phase that just started last Monday. And as I said before, it will depend on the supply of vaccine that we get and the number of people that are getting vaccinated during that phase. Certainly schools will be a part of it. And we will work closely with the county hub, the county hub, on the distribution of the vaccine when it's ready in phase 2 for the general population.
I just want to interject a little bit because when we mentioned about schools, children have not been part of the trials. So participants under the age of 16 have not been has not been trialed out, and it hasn't been recommended. And the reasons why is the experts say, and as people who do practice pediatric medicine, vaccination in children, there's the things with dosing and scheduling. So that has to still be tested and trialed out. So for children, I think it's going to be a long way off. But so just wanted to put that piece in.
Yeah, to clarify, when I said school, I meant colleges, universities, adult children. I did not think about the other age, the grade school children. I was thinking about schools of higher learning.
Thank you. Thank you. I have a question, Dr. Lopez, if you can take that. Will the undocumented immigrants putting themselves in a risk to reveal their status? What is the rollout for the undocumented?
So yes, we have to do a lot of community education in the undocumented community. We do want to reach the undocumented community. Obviously, we will need to ask questions regarding their place of residence and things like that, because that's needed by the state of New York, particularly because this is a 2-dose vaccine. And so we will need to ask some personal questions during the intake, but this is not to track or to call into question who's here and who isn't here legally. It really is just to track the dose of the vaccine, the person we gave it to, and so on and so forth. So we're going to try to limit the number of demographic information we have to collect. They will need to sign consent for the vaccine in the state of New York. But we will not be tracking, whether we're not going to ask questions about whether they're here legally or not. We want to be able to vaccinate the undocumented community, particularly the large migrant farmer community that we have that lives with us during the seasonal times.
Great, thank you. Ms. Mozawala, does the county have a plan? How do we need to infuse that trust in the undocumented community?
So one of the things I do want to say is that the federal government no longer requires states to have any kind of personal identifying markers like a driver's license or your social security number. So they won't be asking for that information. And one of the ways we want to make sure is we want, we saw it with the census 2020, how people were nervous about that citizenship question. So we want to make sure that the communities know that no personal identification markers will be asked or required of anybody. And, we have to realize these immigrant communities and they don't have the same, they don't communicate in the same methods that maybe average Americans communicate. They use WeChat, they use WhatsApp, Viber, they use these different types of social chats, they use ethnic media. So anybody who's giving the information to these communities needs to use their platforms, not just mainstream platforms. So that's very important. We really need to start and learn the different nuances within these communities and start using their modes of communication also.
Ahmad, let's take a few questions. If I may, I know you guys are extremely busy, but we have these, and as you see, our audience is a very diverse audience, and we are very blessed to have that, because you guys are the source of information. Extremely grateful for your time. Reverend Felker, you made this happen. Thank you so much. for that trust and that respect for the communities. So Ahmad, let's take a few questions before we really, if we have it good, let's stretch it a little with this family.
The first question, when will the vaccine be available for everyone? And Dr. Isma, if you'd like to assign that question to a specific person.
Debbie, if you can please take this question. You were the
Sure.
last one coming out of that boardroom.
Yes. Again, the general population is considered phase 2. I want to say it can happen as early as January, mid-January to late January, but we really don't know. Just to reiterate, we have to focus on the supply of vaccine that we're going to get. Vaccinating in the essential group people alone, it's a lot of people in that essential group category. It's a lot of community members. So how quickly we can get the supply, how quickly we can distribute the supply, and who actually comes in to get it during that period of time will determine when the next phase can be kicked off. But we want to say January, mid-January, maybe sooner, late January. It really will depend on supply.
Great.
Next
Thank
question.
you so much.
How long is the vaccine effective for? Yesterday, I heard an MD on the radio say that it was effective up to 120 days. That's nothing. I was surprised. And that question comes from Julie Nafto.
Dr. Gupta, you want to take a shot at that one?
Sure. I mean, I think we actually don't have a great answer to that question. Because this is a new vaccine rollout, and there has been a trial, but we don't know about the durability. I mean, there are a lot of factors that go into this, so we don't know about the durability of the vaccine and our antibody response over time. We know things just like we're hearing in the media now about mutations and strains. So, just not using like our flu vaccination as a corollary, but there's a reason that we take new flu vaccination every year because of the mutability of flu out there. Now, COVID is a completely separate and different virus. It's not a flu virus. It's a SARS virus. But I guess my long answer to a very short question, and I'm going to shorten this, is that we actually really don't know how long it's going to last, but I suspect it's going to be a lot longer than 120 days. Is this 1 year? Is this 5 years? Is this 10 years? We really don't have the answer to that question yet, but I think it's going to be much longer than the 120 days that was mentioned in this question.
Great. Ahmad, we can just take one more question because I really don't want to stretch. I do interact with these individuals outside the screen. So
the CDC is reporting on their website that on December 18th, 2020, about 3,000 serious adverse reactions after injecting roughly 112,000 people. They define serious as unable to perform daily activities or go to work and requiring doctor's care. Is that a normal rate?
Anyone. It's Dr. Hassan, thank you.
Yeah. So I mean, I don't know if that's a normal rate. It seems like it's a little high, and I think the thing to remember here is that we're approaching the vaccine with an overabundance of caution for obvious reasons. We don't want anyone to get sick. We also don't want to alarm the general public. We want to make sure everyone is as safe as possible. I can tell you that people that I know that have been getting the vaccine, no one's really had a serious adverse effect. I think asking people that do have serious effects, whether that's a rash or arm soreness or fever, keeping them home is probably just a way to make sure that there's nothing else going on, and making sure that people are as safe as possible rather than an actual problem with the vaccine itself. I think that's the best that we can answer that question with, is just because all this is new, these numbers are, high because people just want to be sure that they're careful about this. I do think that the vaccine is very safe. I don't think that the government and all these companies would release something that they don't think is safe either. And the fact that so many healthcare workers have been taking the vaccine and really lining up to do it just speaks volumes about the safety of the vaccine. I know I'm encouraging my family to get the vaccine as soon as it's available to them, and I can't think of any better endorsement than that.
Dr. Chaudhary, before we close, I just have to thank you for inviting us for this forum. Communication, education, transparency, and trust are critical for us to make sure that the community feels comfortable enough to take the vaccine. As we said earlier, we need 70% for herd immunity. The more people that understand, have questions, you see our physicians were very honest about questions that they're unable to give you a solid, constructive answer. We're learning as we all go along. So we want to thank you for having this panel. I want to thank you for working with us. And we've been working together in this field for a long time. I appreciate this evening, and I thank all of you. I thank our Northwell physicians, and be well and be safe.
Thank you so much.
Thank you.
I started off by saying that this is, and I can't thank you guys enough for being candid, for being responsive to the questions, and for collaboration and that partnership. This is the time I started with a sense of coexistence and we are codependent on each other. And it is extremely important that we understand our role as the community leaders, physicians, public health professionals, county, media people. We are all in it together. We all have to help us get out of this. So can't thank you enough for your time. You guys are extremely busy, and God bless. Thank you so much. And we are here. If there is anything that needs to be rolled out, we would love to partner with the communities as well as Northwell County. Thank you, Ahmad. You have done really a remarkable job during this pandemic. Thank you so much. Thank you, everyone.
Yeah.
Thank you.
Thank you.
Happy holidays.